You probably have a little vitamin drawer somewhere in your kitchen or bathroom. And if you're over 60, chances are you've been told, take more supplements, they'll keep you healthy and young. But here's the hard truth. Some of the most popular vitamins sold to seniors can quietly increase your risk of cancer, stroke, nerve damage, or heart problems when taken the wrong way. While a few less flashy nutrients could actually help protect your bones, brain, and immune system as you age. In this video, we'll walk through 4 vitamins most seniors should never take casually, 4 nutrients you should talk to your doctor about taking every day, and how to make smart choices without getting lost in the marketing noise. Quick note, this video is educational only. I'm not your doctor. Always talk with your own healthcare provider before starting, stopping, or changing any supplement. Why more vitamins can backfire after 60. Let's start with something surprising. A major U.S. panel called the U.S. Preventive Services Task Force reviewed dozens of high-quality studies on vitamin pills for adults living at home. Their conclusion: they recommend against taking beta-carotene or vitamin E supplements to prevent heart disease or cancer, and they found no clear benefit from multivitamins for these purposes. In other words, for generally healthy adults. Popping random vitamins does not make you bulletproof, and some may do harm. Now add this. By the time we hit our 60s and 70s, we're more likely to have slower kidneys and liver, so we clear extra vitamins more slowly, take multiple medications that can interact with supplements, have thinner bones, stiffer arteries, and fragile nerves, which can be pushed over the edge by the wrong doses. So for seniors, the question is not which vitamins are good, it's which ones actually help me and which can quietly hurt me. Let's start with the 4 most concerning ones. 4. Worst. Vitamins. Seniors should never take casually. These are not evil nutrients. Your body may need all of them in small amounts from food. The danger is in high-dose pills and self-prescribing without medical guidance. 1. High-dose beta-carotene and vitamin A. Especially if you've ever smoked, you might see beta-carotene in eye health, anti-aging, or immune supplements. It's a plant pigment your body can turn into vitamin A. But here's what large clinical trials found. In the ATBC trial of over 29,000 male smokers, men taking beta-carotene had more lung cancers than those taking placebo. Another big study, CARET, in smokers and asbestos-exposed workers had to be stopped early because beta-carotene plus vitamin A caused 28% more lung cancers and 17% more deaths in the supplement group. Regulators now warn that current and former smokers should avoid beta-carotene supplements, and even AMDI formulas were changed to remove beta-carotene for this reason. Age-related eye diseases, vitamin A itself, retinol, is also risky in high doses. Too much can cause liver damage and bone loss, increasing fracture risk in older adults. Practical takeaway: if you ever smoked or currently smoke, be very cautious with any supplement that lists beta-carotene or high-dose vitamin A. Getting carotenoids from colorful fruits and vegetables, carrots, sweet potatoes, leafy greens, does not show the same lung cancer risk and is generally considered safe. 2. High-dose vitamin E. More bleeding, no clear benefit. Vitamin E is often marketed as a heart and anti-aging antioxidant. But when scientists looked closely, the story got messy. The USPSTF explicitly says, Do not use vitamin E supplements to prevent heart disease or cancer. Why? A meta-analysis found that high-dose vitamin E offered no overall cardiovascular benefit, and in some trials, it was linked to increased risk of heart failure and death. Another analysis showed vitamin E supplements increased the risk of hemorrhagic stroke, bleeding in the brain, by about 22%, even though it slightly lowered ischemic stroke risk. Mechanism? Vitamin E can thin the blood and interfere with vitamin K-dependent clotting. If you're already on blood thinners, warfarin, apixaban, etc., or have a history of strokes or bleeding problems, then unmonitored vitamin E supplements can be especially risky. Practical takeaway: focus on vitamin E from foods, nuts, seeds, healthy oils. Avoid high-dose vitamin E capsules, 400 to 1,000 international units, unless a specialist specifically tells you to take them and is monitoring you. 3. High-dose vitamin B6, pyridoxine, silent nerve damage. Many B-complex and energy pills contain vitamin B6. B6 is essential, but in small amounts. At high doses over long periods, B6 can do something deeply unfair. It can damage the very nerves it is supposed to protect. Toxicity often shows up as peripheral neuropathy, numbness, tingling, burning, or loss of balance in hands and feet. Case reports show neuropathy even at doses under 500 milligrams per day taken for months, and classic toxicity above 1,000 milligrams per day. Because of rising reports, regulators in several countries now require warning labels and have lowered the allowed maximum daily dose in supplements. For older adults, this is especially cruel. Neuropathy from diabetes, B12 deficiency, or spinal problems is already common. Adding B6 toxicity on top makes diagnosis and treatment harder. Practical takeaway: check your labels. Add up B6 from B-complex, multivitamins, energy drinks, protein powders, nerve supplements. If you're getting more than 50 milligrams per day, especially for months, bring that list to your doctor. If you feel new burning, tingling, or loss of balance, ask, could my B6 be too high? 4. Heavy calcium pills, good for bones, bad for arteries. For many years, the message to seniors was simple: take extra calcium for your bones. But newer research paints a more complicated picture. Some large analyses have suggested that high-dose calcium supplements, typically around 1,000 milligrams per day from pills on top of diet may, increase the risk of cardiovascular disease by about 15% in healthy postmenopausal women in some trials, be linked with more heart attacks in certain studies when used without careful monitoring. Other newer meta-analyses show more neutral results, so this is still debated. But almost everyone agrees on 2 points. Calcium from food, dairy, leafy greens, fortified foods, appears safer than big calcium pills. Too much calcium, especially with vitamin D, can cause kidney stones and, in extreme cases, contribute to kidney and heart problems. Practical takeaway: don't automatically take 1,000 to 1,500 milligrams calcium tablets just because the bottle says for strong bones. Add up your diet plus supplements and aim for a total in the usual recommended range for your age, often 1,000 to 1,200 milligrams per day, unless your doctor says otherwise. If you have kidney disease, heart disease, or a history of kidney stones, talk to your doctor before using calcium supplements at all. 4 nutrient seniors often need more of now to good news. While some vitamins are overhyped, there are nutrients that many seniors genuinely don't get enough of, and they can make a real difference in daily life and long-term health. Think of these as talk to your doctor candidates for daily use. Must have one. Vitamin D, often with a sensible amount of calcium. As we age, three things happen. Our skin makes less vitamin D from sunlight. We may spend less time outdoors. Our gut may not absorb minerals, like calcium, as efficiently. Vitamin D plays a central role in bone strength and fracture prevention, muscle function and balance, immune and metabolic health. Older trials suggest a daily 700 to 800 international units of vitamin D helped reduce hip and other fractures in older adults, especially when combined with calcium. More recent big trials in community-dwelling adults have shown mixed results for fracture prevention, and the USPSTF does not recommend routine D plus calcium for falls or fractures in otherwise healthy, independent seniors. So how do we make sense of this? Vitamin D is still essential for bone and muscle health. Many older adults are deficient or borderline low, especially those who rarely get sun or live in facilities. What you can do? Ask your doctor for a 25OH vitamin D blood test. If you're low, they may suggest 800 to 2000 IU per day, or another individualized dose. Combine it with adequate dietary calcium, and only as much supplemental calcium as you truly need. This approach helps protect bones without flooding your system with unnecessary calcium pills. Must have. 2. Vitamin B12, brain, nerves, and energy. Vitamin B12 is crucial for healthy nerves and myelin red blood cells, preventing certain types of anemia, memory, mood, and thinking speed. Here's the catch. As we age, our stomach acid and absorption drop, and many seniors take medicines, like acid blockers or metformin, that further reduce B12 absorption. Multiple reviews estimate that 10 to 20% of people over 60 have definite B12 deficiency, and even more have borderline low levels. Recent research from UCSF even suggests that normal B12 by current lab standards may still be too low for optimal brain health, with lower active B12 linked to slower thinking and more white matter damage on brain scans. Home. Symptoms of low B12 can be sneaky. Fatigue and weakness, numbness or tingling in hands, feet, memory lapses, confusion or depression, walking unsteadily. What you can do: ask for B12 testing, especially if you're older, vegan, vegetarian, or on acid-suppressant meds or metformin. If levels are low or borderline, doctors often recommend oral B12 tablets or sometimes injections. Typical supplement doses are safe because B12 is water-soluble and excess is usually excreted. A daily B12 supplement, once your doctor agrees, can be one of the simplest ways to support brain and nerve health as you age. Must have 3. Magnesium, the quiet mineral for muscles, heart, and sleep. Magnesium doesn't get the spotlight like vitamin D, but it's involved in more than 300 reactions in your body, including muscle relaxation, nerve signaling, blood pressure control, and energy production. Here's the issue. Studies suggest that 10 to 30% or more of older adults have low magnesium levels, especially those with chronic illnesses or on diuretics and other common medications. Symptoms of deficiency can include nighttime leg cramps and muscle twitches, fatigue and poor sleep, high blood pressure, irregular heartbeat in severe cases. On the other hand, excess supplemental magnesium can cause diarrhea, nausea, low blood pressure, and heart rhythm problems, especially in people with kidney disease. Because of this, experts set a tolerable upper intake level of 350 milligrams per day from supplements, not counting food. What you can do: first, increase magnesium-rich foods, leafy greens, nuts, seeds, beans, whole grains. If you still have cramps, insomnia, or confirmed low magnesium, ask your doctor whether a modest dose magnesium supplement, often 100 to 300 milligrams, might help you, and which form, citrate, glycinate, etc., is best with your medications. For many seniors, a small, well-chosen magnesium supplement taken with medical guidance can improve sleep quality, muscle comfort, and overall vitality. Must-have 4, vitamin C, immune and tissue support. Especially when diet is poor, vitamin C is a classic for a reason. It's required for collagen, your skin, blood vessels, cartilage, and wound healing, immune function, antioxidant protection against everyday cellular damage. While severe scurvy is rare, quiet vitamin C deficiency is not uncommon in older adults, especially those in hospitals or care homes eating few fresh fruits and vegetables with chronic illnesses or high inflammation. Some findings: in one hospital group, over 80% of elderly patients were deficient in vitamin C. Studies suggest vitamin C supplementation at modest doses like 200 to 1,000 milligrams per day can improve immune function and may reduce the duration or severity of respiratory infections in older people with low levels. Too much vitamin C, especially greater than 1,000 to 2,000 milligrams per day for long periods, can cause diarrhea and may increase kidney stone risk in susceptible people, so more isn't always better. The sun. What you can do: aim for several servings of fruits and vegetables daily. Citrus, berries, kiwi, peppers, broccoli. If your diet is limited, or you're in a setting where fresh produce is scarce, a modest vitamin C supplement, often 250 to 500 milligrams per day, may be worth discussing with your doctor. For many seniors, this is an inexpensive way to support immune health, wound healing, and energy. How to simplify all this for your daily life? By now you might be thinking, this is a lot. Just tell me what to actually do tomorrow morning. Here's a simple checklist you can discuss with your healthcare provider. Step 1, empty the supplement drawer. Take every bottle you're using, vitamins, herbs, powders. Make a list of the name, dose, and how often you take each one. Pay special attention to any supplement containing beta-carotene or high-dose vitamin A, vitamin E capsules, especially 200 to 400 international units or more, B-complex or nerve vitamins with B6 greater than 25 to 50 milligrams, big calcium tablets, 500 to 1,000 milligrams, taken more than once a day. These are your red flag items to review with your doctor. Step 2, ask your doctor for targeted blood tests. Instead of guessing, ask about vitamin D level, vitamin B12 level, possibly magnesium and iron. If you have fatigue, cramps, or anemia, the times of India. Now, your supplement plan becomes personal, not generic. Step 3, build your short list with your doctor or pharmacist. Decide whether it makes sense for you to take. A vitamin D supplement, dose based on your level. A B12 supplement if your levels are low or borderline. A modest magnesium supplement if deficient or symptomatic. a vitamin C supplement if your diet is poor or you're at higher risk of deficiency. Plus, only as much calcium as needed to fill the gap between your diet and your recommended daily intake? No more? You go from a cluttered drawer to a small, purposeful routine that actually matches the science and your lab results. Gentle warning, strong encouragement. If you've watched this far, you're already doing something powerful. You're not just swallowing whatever a colorful label tells you. You're treating your 70, 75, or 80-year-old body like it deserves, with respect, caution, and curiosity. The supplement industry is worth tens of billions of dollars globally, and a lot of that money comes from people over 60. But as one major review put it, antioxidant supplements like beta-carotene and vitamin E have failed to show benefits and may even increase mortality in some groups. You deserve better than trial and error on your own health. If you're comfortable, here's what I'd love you to do next. Hit like if this helped clear up any confusion about vitamins. That tells YouTube to show this to more seniors who need it. Subscribe to Zen Age Life so you don't miss the next videos where we'll go deeper into senior-friendly nutrition, exercise, sleep, and brain health, all in simple language. In the comments, tell me, which supplement are you now planning to ask your doctor about? I read these, and your questions often become future videos. You don't need a suitcase of pills to age well. You need a smart, simple plan and a community walking that road with you. This is your narrator name from Zen Age Life. Take good care of yourself today. Your future self is already thankful.